Our lab is focusing on autonomic symptoms, and among autonomic symptoms, we also focus our attention on sweating disturbances. So we apply advanced technique to evaluate the sweating function, thermoregulatory function in patients with ALS by applying this new technique that is called dynamic sweat test, DST, that was developed in our lab in Naples in collaboration with Professor Nolano. With this kind of technique, we are able to measure the number of glands, sweat glands that are activated, but also the sweat output. So we demonstrated that in patients with ALS, there is a decrease of sweat output across the disease. In a longitudinal study, we demonstrated that ALS patients showed a decrease of sweat output, and this kind of decrease of sweat output was also associated with a worse prognosis. So sweating can be also using as a prognostic biomarker in these patients. Another interesting thing was that the bulbar onset patients showed a higher autonomic burden, and also they complained more sudomotor dysfunction compared with the patients with the spinal onset phenotype. So this is really interesting because the bulbar phenotype is intrinsic, more aggressive than other form of the disease. And we think also that these patients showed a widespread disease, and among non-motor symptoms, autonomic burden is really important and in this kind of patients. Yeah.